Welcome into Your Health, and we are so blessed again this week to have back with us Dr. Paul Moore. And Dr. Moore, you're a cardiologist, have known you for years. We love you, and we are going to try to help some people so that they can live longer today. And we're going to talk a little bit more about some of these symptoms that are very easy to overlook or to blame on something else, and the fact that women and men are different in the way they present. So let's talk a little bit more about some of the things we should be looking for that may be a heart issue and not a heartburn issue.
Right. Heart disease is very, very common. Most Americans die of cardiovascular disease. More people die of cardiovascular disease than all cancers combined. So it's important to be aware of the subtle or the not so subtle symptoms of heart disease. And chest pain is not all that common a manifestation of coronary disease or coronary artery disease or blockages in the arteries. When I explain to my patients that they are not very likely to have chest pain, they kind of look puzzled or quizzical about it. In fact, most patients who have blockages in the arteries of their heart or coronary artery disease don't have pain per se. They have a tightness or a squeezing in the chest. It may just be an uncomfortable feeling. And a lot of times it's mistaken or misperceived as indigestion. And that's where people get into so much trouble. They stay at home, they don't get help, they pass it off as indigestion or heartburn, and they really delay their treatment, delay their diagnosis. So unusual shortness of breath, unusual fatigue are very common manifestations of coronary artery disease or heart attack or heart pain. And the entire gamut can run. I had one lady come in with a heart attack, this is probably 25 years ago, and her only pain was in her earlobes. And she was definitely having a heart attack, and when we opened the artery up with a balloon, the pain went away. So I know that her pain was from her heart. Women tend to have different symptoms than men do. The textbooks are all written about men's heart disease, and women tend to have less chest pain and more just unusual or vague symptoms like fatigue or shortness of breath or nausea. Women are more likely to have neck discomfort than they are to have chest discomfort, and or back discomfort, pain between their shoulder blades. So any symptoms that sound like that, you probably ought to at least discuss with your primary care physician, and your primary care physician can look into it further if necessary. The rule that I go by is that about a third of the time people who have important blockages in the arteries of their heart have typical angina. That's the tightness or pressure in the chest when you exert yourself that I was talking about. About a third of the time they have those vague symptoms, shortness of breath or fatigue, and about a third of the time they have no symptoms at all. So that unfortunately, about a third of the time, the first manifestation of coronary artery disease is sudden death, and that's not a good way to find out you've got it. So if you have those vague symptoms, get help or get advice.
Well, it makes good sense, and an ounce of prevention is worth a pound of care. And we'll talk a little bit when you come back about what we can do about some of these things. And thank you so much for coming in. I know you're all exhausted and extremely busy, and we ask again, please wear your mask, socially distance, wash your hands. Don't put your hands on your face. That's how the germs come through the nose and the mouth and the eyes. So be careful, and thank you for being with us, and we'll be right back.